It's actually quite astonishing when you think about how much money just disappears. In plain sight, really.
You're talking about healthcare fraud, waste, and abuse.
Exactly. And most people, I think, don't realize the sheer scale of it. It costs the U.S. healthcare system, well, hundreds of billions every year.
Some estimates even push it towards, what, 700 or $800 billion annually?
Yeah, it's staggering. That breaks down to over $300 a year for every single American. Just vanished. So this deep dive is all about how artificial intelligence, AI, is playing this really critical but honestly double-edged role here.
Double-edged is the right word. On one side, you've got the bad actors weaponizing it, creating scams more sophisticated than anything we've seen before.
But then on the other side, it's also our most powerful tool for fighting back, right? For detecting fraud, protecting patient trust, and, yeah, saving billions.
Precisely. So our mission today is really to unpack these surprising ways AI is being used by both sides in this high-stakes battle.
We'll look at the key signs you should watch out for and explore how these new AI technologies are genuinely transforming the fight against healthcare fraud. Okay, let's unpack this.
Where do we start? The scams themselves.
Yeah, let's start there. Because when we talk about healthcare scams, the classics are still very much in play.
You mean things like phantom billing?
Exactly.
Yeah.
Charging for services you never actually received, or upcoding billing for a more expensive treatment than what was really provided.
And unbundling too, right? Charging separately for every little step in a procedure that should be one single bill.
Right. But the thing is, these traditional tactics, they're now being massively amplified, weaponized even by digital methods, especially generative AI.
And it's that amplification that makes today's fraud so much tougher to spot. Fraudsters are using generative AI to create these, well, incredibly convincing deceptions.
Like what specifically?
Well, they can simulate a doctor's voice almost perfectly, forge clinical documents that look completely legitimate. They can even mimic diagnostic imagery.
Wow. Down to the pixel.
Pretty much. Or create deepfake videos, maybe audio clips, of trusted professionals seemingly endorsing fake products or trying to trick people into giving up sensitive info.
That's chilling.
Yeah.
Because the AI-generated stuff can look so authentic, almost impossible for the average person to tell it's fake.
Exactly. It bypasses our usual checks. And it's not just about faking a single form anymore. AI lets them operate on a massive scale.
You mean like automating the fraud?
Yes. Think about scanning obituaries to steal the identities of people who've passed away, then automatically filing tons of forged claims under their names.
Or coordinating huge international networks. I read about schemes involving things like fake catheter supplies, just enormous operations.
Right. These things can run for months, racking up huge losses before anyone notices, all because AI makes the automation and scaling possible.
And it goes beyond just fake claims, doesn't it? Sometimes the AI systems themselves are targeted.
Absolutely. We've seen cases where the algorithms are corrupted, manipulated to actually steer clinical decisions in a way that benefits the fraudsters, not the patient.
That sounds incredibly dangerous.
It is. Take the 2020 Practice Fusion case. This was an electronic health record and EHR vendor.
Okay.
They allegedly took kickbacks from an opioid manufacturer, and what did they do? They actually modified their AI-driven clinical decision support alerts.
Wait, the prompts doctors see in the system?
Exactly. Those intelligent nudges meant to guide medical choices. In this case, they were allegedly tweaked to push physicians towards prescribing more opioids than were medically necessary.
That can be deeply disturbing. Manipulating the tools meant to help doctors.
It shows how even the helpful systems can be corrupted for profit, undermining patient safety right at the source.
And then there's the sheer scale of identity theft and billing fraud AI enables. You mentioned Operation Gold Rush earlier.
Yes, Operation Gold Rush 2025, a landmark case for the U.S. Department of Justice.
What happened there?
Essentially, you had Russian and Eastern European criminal networks using stolen U.S. identities. They also used what are called straw owners, basically front people or shell companies, to hide who was really behind it.
Okay, and what were they doing?
They filed over $10.6 billion in false claims, mostly for urinary catheters that are never ordered, never delivered, just pure fabrication on a massive scale.
$10 billion. And AI played a role.
It's almost certain. AI tools likely handled the automation, the scaling of submitting all those fraudulent claims. It let them exploit weaknesses in how identities and claims were checked.
So with all this happening, it really brings it home. How do you, the listener, protect yourself? What are the red flags in this sort of AI-driven scam world.
That is the crucial question, isn't it? There are definitely things to look out for.
Okay, what's number one?
First, be really wary of unsolicited contact. Calls, texts, even video messages coming out of the blue. Someone claiming they're a relative, a doctor, maybe an insurance rep you weren't expecting.
Got it. What else?
Second, notice the urgency and pressure. If the caller insists you have to act right now, maybe claims there's a medical emergency, and importantly, discourages you from checking the story. That's a huge warning sign.
Okay, urgency. Makes sense.
Third, requests for untraceable payments. Scammers love wire transfers, gift cards, cryptocurrency, payment apps like Zelle or Venmo, things that are hard to get back.
Right, the classic scammer payment methods.
Fourth, secrecy demands. If they tell you, don't tell anyone about this, that's a tactic to stop you from getting a second opinion or realizing it's a scam.
Isolating the victim.
Exactly. Fifth, look for inconsistencies in audio or video. Deepfakes aren't perfect yet. Look for unnatural blinking, maybe jerky movements, weird lighting, or speech that sounds a bit stilted or robotic.
Subtle clues, but important.
And finally, sixth, be incredibly suspicious of requests for personal health or insurance information. Legitimate providers, your real doctor's office or insurance company, they won't just call you out of the blue asking for sensitive data like that.
So lots to watch for. What's the immediate action plan if someone suspects a scam?
It really boils down to being vigilant. Simple but effective steps. If something feels off, just hang up. Don't engage.
Hang up. Okay.
Then, call back using a verified number, not the number they called from or gave you. Look up the official number on your insurance card or the hospital's website.
Good advice. What if it seems like a loved one?
Ask personal questions. Something only the real person would know. A shared memory, an inside joke, something a scammer couldn't possibly guess.
Smart. And report it.
Absolutely. Report suspicious activity to the Federal Trade Commission, the FTC. Your report might seem small, but it helps them build cases and protect countless others.
So vigilance, verification, and reporting. Got it. Now, beyond these deliberate scams, there are also these unintended consequences, right? AI making mistakes.
Yes, that's another serious concern. Sometimes the AI itself, even if not maliciously programmed, can make significant errors. Misdiagnosis, for instance.
Is there an example of that?
There is the NHS AI tool called Annie back in 2025. It's quite a shocking case, actually.
What did it do?
This AI tool falsely diagnosed a perfectly healthy man, mid-20s, with type 2 diabetes and suspected heart disease.
No. Based on what?
That's the thing. It seemed to fabricate symptoms. It listed things like chest pain, shortness of breath, none of which he had. It even cited a fictitious hospital address in his record.
How did he find out?
He got an invitation for diabetic eye screening in the mail, based entirely on this wrong AI-generated summary in his health record.
That's terrifying. It really highlights the danger of relying on unverified AI outputs, especially in healthcare.
It really does, even for tools considered low risk. It's a stark reminder that AI is only as good as data it's trained on and how well it's validated. Makes you pause, doesn't it?
It certainly does.
So what's fascinating here, connecting back, is how AI's ability to create these convincing fakes or automate these massive fraud campaigns, it really shifts the whole attack surface. Traditional detection methods, they just struggle to keep up.
Which brings us back to that central question. If AI is so good at creating fraud, can it be equally good, maybe even better, at stopping it?
That's the hope and, frankly, the necessity.
Right, that's the crucial tension we're exploring. Because the same power that makes AI this formidable weapon against us, well, that's also what makes it our most promising defense.
Exactly. While the dark side of AI and fraud is potent, the bright side AI used as a defense is proving incredibly powerful.
Because the old ways just don't cut it anymore. Manual audits and things like that.
They're just too slow, too limited. They can't keep pace with how fast fraud evolves, especially digital fraud. That's where AI comes in.
Using machine learning, natural language processing.
Right. These technologies allow for a fundamental shift.
Yeah.
We move away from just reacting after the fraud happens towards proactive, even real-time intervention, preventing the money from going out the door in the first place.
So how does it actually do that? How does AI detect the fraud?
Well, the core is analyzing truly vast amounts of data. Billions of claims, electronic medical records, pharmacy data, provider histories, information on a scale humans simply can't process effectively.
Okay, it sees the big picture?
It sees the big picture and the tiny details. It identifies subtle statistical anomalies, non-obvious patterns that would be invisible or take auditors years to find.
How does it spot those anomalies?
It works by establishing baselines for what's considered typical behavior for a patient, a provider, a type of service. Then it flags deviations from that baseline.
Like sudden spikes in billing.
Exactly. Or maybe atypical services being billed for a certain condition. Or even unusual timing, like a provider suddenly billing for a huge number of expensive genetic tests right at the very end of a patient's life.
When that testing usually happens much earlier, if at all.
Precisely. AI flags that pattern as suspicious, something a human should investigate further.
So it's like this digital bloodhound constantly sniffing out irregularities that would normally just slip through the cracks.
That's a good analogy. And it's highly effective at spotting specific types of fraud we talked about earlier.
Like upcoding.
Yep. It flags upcoding by checking if the billed procedure code actually matches the documented diagnosis in the patient's record. It catches phantom billing, maybe by cross-referencing patient location data.
Oh, interesting. Like the patient couldn't have been there.
Right. Or just noting impossible service volumes, a doctor claiming to perform 26 hours of services in a 24-hour day. It also spots duplicate claims easily, and that unbundling trick.
What about things like fake medical records? Copy pasting.
That's where natural language processing, NLP, comes in. These tools can actually read and understand the text in medical records.
So they can tell if something's been copied.
They can detect that kind of cut and paste practice, yeah. Or spot implausible documentation. For example, a diagnosis of influenza, but absolutely no mention of common symptoms like a cough or headache in the notes.
That's clever. And identity theft.
AI can spot anomalies there too, like prescriptions being filled under a single patient ID, but in pharmacies thousands of miles apart within just a few hours. Geographically impossible.
Right, it builds a picture.
It does. It also builds comprehensive provider risk profiles based on their claiming patterns, volume, how much they deviate from their peers. It assigns risk scores. High scores trigger investigations.
So it helps prioritize where investigators should focus their limited time.
Exactly. And it's even getting into really sophisticated areas now, like voice biometrics.
Tell me about that. How does that work?
AI analyzes a huge number of unique characteristics in a caller's voice, over 1,300 apparently. Pitch, tone, cadence, even subtle electronic signals from their device.
Creating like a unique voice print.
Essentially, yes. It makes it incredibly difficult for fraudsters to convincingly spoof someone else's voice or impersonate them during telehealth calls or when calling customer service. It verifies the actual person.
Okay, the potential seems huge, but is it actually working? Are there real-world results?
Oh, definitely. The impact is quite compelling. Studies show AI can increase fraud detection rates by 2 to 3 times compared to the old methods.
2 to 3 times better. That's significant.
And importantly, it also reduces false positives, cases flagged as fraud that turn out to be legitimate by 10 to 20%. That saves a lot of wasted investigation time and hassle for honest providers and patients.
Any specific examples? Big savings.
Yeah, MasterCard's AI system, used by some insurers, identified 2,700 high-risk providers and flagged $240 million of potential savings in just one pilot program.
Wow.
And on a bigger scale, CMS, the Centers for Medicare and Medicaid Services, they implemented AI capabilities that automatically stopped improper payments before they went out. The estimate: around $2 billion in savings over 5 years.
$2 billion just from stopping bad payments up front.
And Highmark, a major insurer, reported saving $260 million in a single year using AI for fraud detection. These are substantial numbers.
They really are.
Yeah.
You mentioned Operation Gold Rush again. AI helped crack that massive case, too.
It was key.
Yeah.
The debut of the Healthcare Fraud Data Fusion Center was critical there. It's a multi-agency effort, heavily leveraging AI, cloud computing, advanced analytics.
What did the AI do in that case?
It allowed authorities to sift through mountains of data and proactively identify these clusters of suspicious activity, connecting the dots between seemingly unrelated claims and shell companies.
Finding the network.
Finding the network. That AI-driven analysis led directly to charges against 324 individuals involved in that $14.6 billion scheme. They seized over $245 million in assets and, maybe even more importantly, blocked over $4 billion in suspicious claims from being paid out.
So this is where it gets really interesting, isn't it? We're seeing AI not just reacting anymore, but actively, proactively hunting for fraud, like a digital detective on steroids.
It really is a testament to its power in defense, but that impressive power also forces us to think carefully about the ethical side that challenges those dual-use risks we mentioned. It's not a magic bullet.
Right. It's not just plug and play. This is advanced tech.
And while it's a powerful shield, it remains that double-edged sword.
That's a critical point to keep circling back to, because the sheer cost of healthcare fraud is just staggering.
Sure.
We mentioned $68 billion up to maybe $800 billion a year.
And the old pay and chase model, pay the claim first, try to get the money back later if it was fraud, it just hasn't worked well.
Not at all. CMS alone reported, over $31 billion in improper payments in 2022. Money just gone.
Exactly. And AI is fundamentally changing that dynamic, pushing the system towards prepayment prevention, stopping the fraud before the money leaves.
Which is huge.
And it's not just about detection either. AI actually enhances all the pillars of a good anti-fraud program, what they call FWA, for fraud, waste, and abuse.
All 5 pillars.
Yeah. Prevention, detection, investigation, reporting, and mitigation. It streamlines the investigations, for example, quickly analyzing huge data sets, reducing human error, pulling together information from different places to give investigators a single clear picture.
Making the human investigators much more effective.
Far more efficient, yes. Helping them prioritize the highest risk cases and understand why the AI flagged something.
But as we keep saying, it's still that double-edged sword. Fraudsters aren't standing still.
Not at all. They'll keep trying to exploit AI's capabilities too, like using generative AI to scan those obituaries we talked about, assuming identities quickly before records get updated. It's an ongoing arms race.
Which means we absolutely need strong safeguards.
Crucially, constant human oversight is essential. Robust data governance rules about how data is used and protected. Continuous validation of the AI models to make sure they're still accurate and fair. Transparency is key too.
So AI flags the potential problem.
But human investigators provide the context, the judgment, make the final call. AI is a tool, not the ultimate decider. And we also have to remember that healthcare has historically lagged a bit in adopting modern data management, which creates vulnerabilities fraudsters can exploit.
That's improving, though, right? The adoption of AI.
Oh, yes, rapidly. It's seen as essential now. The global market for AI and healthcare fraud protection is projected to boom from around $600 million back in 2014 to potentially $150 billion by 2026.
Well, that's explosive growth.
It is. CMS is heavily prioritizing AI, especially after seeing the surge in telehealth fraud during the pandemic. And there's legislation being proposed, like the Medicare Transaction Fraud Prevention Act.
What would that do?
It would push for testing AI-based fraud detection systems, similar to what banks use for credit card fraud, including real-time alerts to stop suspicious transactions immediately.
So what does this all mean, then, pulling it together? It really feels like AI isn't just some fancy tech upgrade anymore. It's becoming, fundamental.
Yeah.
A necessity for the basic integrity of our healthcare system.
I think that's exactly right. It's moving from a nice-to-have to a must-have.
Okay, so just to quickly recap what we've covered, AI is fundamentally reshaping this whole battle against healthcare fraud. It's empowering the scammers with sophisticated new tools.
But it's also empowering the defense systems in incredibly powerful ways, detecting patterns, automating checks, preventing losses on a massive scale.
It's this constant evolving arms race between those exploiting technology for illicit gain and those harnessing it to protect patients and, frankly, huge amounts of money.
An arms race where vigilance on all sides is key.
Which leads to a final thought for everyone listening. Consider this. As AI gets woven more and more deeply into every aspect of healthcare diagnostics, treatment planning, billing, everything, how do we make absolutely sure that the very systems designed to protect us don't accidentally create new, maybe unforeseen vulnerabilities, new loopholes for fraud or error?
That's the million-dollar question, or maybe the billion-dollar question.
And perhaps just as importantly, what role do you play as an informed patient, as a consumer? How do you help hold these complex systems accountable and keep reporting anything that looks suspicious? Your vigilance really does remain a vital part of the solution here.